Good afternoon, my name is Ricardo Zurita and I'm going to talk about trial of Amitriptyline, Topiramate, and Placebo for Pediatric Migraine. Definition: migraine is a common disorder in children. Estimates that the 3.5 to 5% of all children will experience recurrent headaches consistent with migraine. Management consists of identifying triggering factors, providing pain relief, and considering prophylaxis.
More than 6 million children and adolescents in the United States have migraine headaches. Current clinical practice guidelines for pediatric migraine are based on expert consensus, given the lack of evidence for specific therapy. The CHAMP trial aimed to assess the benefits and harms of two of the most commonly used medications for the prevention of migraine in pediatric patients. This Phase 3 multicenter double-blind placebo-controlled trial was conducted in the United States and enrolled children and adolescents 8 to 17 years old with a diagnosis of migraine causing at least mild disability and a baseline headache frequency of at least 4 days per month. 361 patients were randomized in a 2:2:1 ratio to oral amitriptyline, topiramate, or placebo for 24 weeks. The trial was stopped early for futility. For the 328 patients with data to analyze, the primary outcome, a relative reduction of 50% or more in the number of headache days, was no different in the three groups, occurring in 52% of those in the amitriptyline group, 55% of those in the topiramate group, and 61% of those in the placebo group.
Applications in medicine. We conducted a randomized double-blind placebo-controlled trial of amitriptyline, topiramate, and placebo in children and adolescents 8 to 17 years of age with migraine. Patients were randomly assigned in a 2:1 ratio to receive one of the medications or placebo. The primary outcome was a relative reduction of 50% or more in the number of headache days in the comparison of the 28-day baseline period with the last 28 days of a 24-week trial. Secondary outcomes were headache-related disability, headache days, number of trial completers, and serious adverse events that emerged during treatment.
Amitriptyline is a prescription medication used to treat the symptoms of depression. Amitriptyline belongs to a group of drugs called tricyclic antidepressants, which work by adjusting the levels of natural chemicals in the brain. This medication comes in a tablet form and may be taken once or multiple times a day, depending on your doctor's instructions. Common side effects of amitriptyline include nausea, vomiting, and weakness. Amitriptyline can also cause drowsiness and dizziness. Do not drive or operate heavy machinery until you know how amitriptyline affects you.
So one of the other questions I get about Qsemia is often, well, what's this other ingredient? I know what phentermine is, but tell me what topiramate is. Topiramate's a medication more commonly used in migraine prevention. It's sometimes used in epilepsy as well. Originally, it was combined with phentermine because one of the side effects of topiramate is weight loss. People would take it and they would lose weight, and so putting them together as one can help facilitate weight loss.
There were no significant between-group differences in the primary outcome, which occurred in 50% of the patients in the amitriptyline group, 55% of those in the topiramate group, and 61% of those in the placebo group. There were also no significant between-group differences in headache-related disability, headache days, or the percentage of patients who completed the 24-week treatment period. Patients who received amitriptyline or topiramate had higher rates of several adverse events than those receiving placebo, including fatigue and dry mouth in the amitriptyline group and paresthesia and weight loss in the topiramate group. 3 patients in the amitriptyline group had serious adverse events of altered mood, and 1 patient in the topiramate group had a suicide attempt. Well, in conclusion, there were no significant differences in reduction in headache frequency or headache-related disability in childhood and adolescent migraine with amitriptyline, topiramate, or placebo over a period of 24 weeks. The active drugs were associated with high rates of adverse events.